Injuries of the tarsal sheath are often associated with thickening of the tarsal sheath wall, with or without associated lesions of the sustentaculum tali. Sometimes we will see mineralization or ossification in the lateral digital flexor tendon. In this horse, in association with this marked distension, there was moderate lameness and marked disruption of the normal architecture of the lateral digital flexor tendon with hypoechoic areas and marked thickening of the retinacular attachment to the plantar aspect of the sheath. A thorapin is an acquired swelling, and we see this here predominantly on the lateral aspect of just proximal to the hock, but it also can be seen medially in some horses. And this effectively is a synovial, so it has a connection with the tarsal sheath. They are often apparent unassociated with lameness, and only occasionally are they a source of pain causing lameness, although for some people they worry about the cosmetic appearance. In the horse on the left, the swelling developed concurrently with the owner recognizing lameness. So she was very concerned that there was a cause and effect. In order to determine whether or not that was the case, we injected local anesthetic solution into the synovial together with radiodense contrast medium. And in the radiograph in the middle, you can see radiodense contrast medium within this synovial, but you can also see outlined the lateral flexor tendon, so therefore demonstrating the communication between the tarsal sheath and this synovial. Ultrasonographically, there was no significant abnormality within the tarsal sheath other than an abnormal amount of fluid. This horse's lameness was actually associated with proximal suspensory desmopathy. This horse has a linear swelling on the plantaromedial aspect of the distal hock and proximal metatarsal regions, creating a slight convex contour to the limb, whereas in the contralateral right hind limb, there is a concavity. This swelling coincides with the anatomical position of the accessory ligament of the suspensory ligament, a ligament that attaches to the plantar aspect of the calcaneus and the fourth tarsal bone. So here we can see ultrasonographic images of the same horse. The yellow arrows in the top image show the anechogenic space where the accessory ligament should be. In addition, this horse also had evidence of mild proximal suspensory desmopathy. And in the longitudinal images, we can see the loss of long linear parallel echoes within the accessory ligament of the suspensory ligament. These large osseous masses on the proximolateral aspect of the third metatarsal and fourth metatarsal bones are usually innocuous abnormalities. They are firm, they are non-painful, they often have a rather smoothly outlined margin as seen in the radiograph here. I have never known associated lameness with these swellings. We don't know why they occur. They may be unilateral or bilateral. In some horses, we will see diffuse swelling in the metatarsal region, which can make palpation of the individual soft tissues rather challenging.